to briefly explain the purpose and use of the Georgia Proxy Caregiving Law, which was passed in 2012, and the impact that it has on care that we give in our personal care home. In 2012, Georgia passed a law allowing unlicensed personnel to provide assistance to patients with health maintenance activities. I will explain these terms in a minute. The Proxy Caregiving Law makes it possible for unlicensed personnel, like nursing assistants or caregivers of any sort, or even a family caregiver, to provide help with a patient's health maintenance activities. A health maintenance activity is something that that patient could probably do for him or herself if it weren't for a disability from which they suffer. Here's an example. If a patient with dementia needs help with her medications, a proxy caregiver can provide administration of those medications. In the past, the state's Nurse Practice Act only allowed registered nurses or licensed practical nurses to provide administration of medications in that situation. Now that's changed because of the Proxy Caregiving Act. So a proxy caregiver has to be specially trained by a registered nurse, a pharmacist, a physician, physician's assistant, or nurse practitioner. That means that not just anybody can be a proxy caregiver, they have to be specially trained. Another example of a proxy caregiving health maintenance activity would be emptying a Foley urine bag. Not inserting the Foley, but emptying the bag. Another example might be assisting with insulin administration by subcutaneous injection. And the last example that we would use in a personal care home would be administration of oxygen by nasal cannula. So in these cases, our unlicensed caregivers are permitted, as long as they're proxy caregiver trained by the appropriate type of nurse or doctor or nurse practitioner, etc., are allowed to help with these things. Again, medication administration for a dementia patient, insulin administration by subcutaneous injection, emptying Foley catheter bags, and applying oxygen. These are items that Providence trains all of their lead caregivers to be proxy trained so that these items can be done for each individual resident who has that need. This information is also useful to families as you are out there looking at personal care home environments or assisted living environments for your loved one. If you have any questions, give me a call. My website's www.providenceal.com. Thanks.